am Dr. Rebecca Carter, Assistant Professor of Pediatrics at the University of Maryland School of Medicine and pediatrician at University of Maryland Pediatrics at Midtown. Today I'm answering some frequently asked questions about childhood asthma. So the first question that I often get asked is in relation to what are the common symptoms of asthma. A lot of times, even at a young age, parents are coming in wanting to know how would they know if their child had asthma, how would it present. So I think in order to answer that, it's helpful to take a step back and go through what asthma actually is. So if you look at the models I have over here, on this one I have a model of a healthy lung. So if you notice going down the airway, you actually see it sort of branches out. So it looks like a tree, and it gets to smaller branches as you go through. So it's smaller and smaller branches at the end of the airway, which are the tubes that you use for breathing. And if you go across, you see that as you go across from mild to more moderate and then more severe, you see a lot more inflammation coming into the inside of that airway. So if you look at what the inside of the airway or that tube would look like, for a healthy lung, it would be nice and open, so you have a nice round tube. And then when you have someone with chronic asthma, you actually see that it has ongoing inflammation all the time on the inside of that airway. So you're already breathing at baseline through a bit of that narrow tube. And then when you get an asthma exacerbation, that inflammation worsens significantly on the inside so that it's squeezing that tube so that it's pretty narrow on the inside. But then also on the outside, you see the muscles that go around the airway are constricting or tightening around. So it's really this tightening on the outside and the narrowing and increased inflammation on the inside that makes it much more difficult to breathe. So going back to that, when you start having those symptoms, children will present often with wheezing episodes. Wheezing might sound audible so that you can hear it for the parent, or it might be something that we only hear when we're listening with our stethoscopes in the pediatrician's office. So that's going to be usually a sound that they're making that's a bit high-pitched at the end of their exhalation of breathing, but sometimes as it gets more severe, you'll hear it even with breathing in and breathing out as well. So sometimes you'll hear that wheezing. Sometimes children will present with just an ongoing cough, which will often be that feeling of all of this tightness going on and they're trying to cough, which in some ways helps to open that airway. So a child with chronic cough that we can't attribute to other causes, we'll often evaluate if we think that that might be asthma as well. Some children just feel all of that happening and will tell you that their chest feels tight. So that's something that we definitely would say would be worth prompting you to bring your child to the pediatrician to get an evaluation if they're chronically telling you that they just feel that their chest has this tightness to it. So that's sort of the ways that we would think about. And then the last one is if they're in the setting of an actual exacerbation, they might actually start to get short of breath. So you might notice them breathing really quickly and really sort of rapidly trying to work hard. I usually tell parents it sometimes can look like they've just been out trying to run a marathon, but they might be sitting at home completely at rest doing those things. So the symptoms that you're going to look for as the parent would be flaring their nostrils when they're breathing, sucking in right at the bottom of their neck, squeezing between their ribs and at the bottom of their ribs, and then using their belly, breathing sort of really hard and really fast. And those are all signs that somebody is really using all of those muscles, trying to get the air in and try to overcome all of that constriction that's going on into their lungs. So thinking about that, a lot of times then what parents want to know, what causes it, and sort of by extension, what can they do to prevent it? Unfortunately, there's not a lot of things we can do to completely prevent it. For the vast majority of times, it winds up being somewhat genetic. So if there is a strong family history of asthma, that child might be more likely to go on to develop asthma themselves. Also, if there's a strong family history of seasonal allergies or eczema, sometimes all of those things are related in what we call the sort of triad, and those things all tend to go together. So a family history with a lot of that going on might make that child more likely to eventually go on and be diagnosed with asthma. But then there's also things that can worsen it. So children who are born premature often have what we consider chronic lung disease, and those lungs tend to be a little bit more susceptible to ongoing vulnerabilities, such as an eventual diagnosis of asthma. And then things that people maybe have a little bit more control over is sort of the environment that they're living in. So sometimes there's things like pollution in the air, which makes it a little bit more likely, but then there's also smoke. So a lot of us are familiar with the concept of smoke exposures, and we know at this point that that's bad for the lungs. So generally when people think about that, they think that either the smoker is affected, and now people generally understand that secondhand smoke can also affect the lungs. So secondhand smoke is just the exposure to someone else smoking. And in order to avoid that, we recommend that if a parent or caregiver is in the home and does smoke, that they are only smoking outdoors. We absolutely recommend that they stop smoking altogether if they're able to, but if they're not in a time or place where they're ready or able to quit, then at least only smoking outside of the house. And then there's also this concept of third-hand smoke, which is actually the particles that stay on their clothing and their hair and sometimes in your skin and the hands, face after you've smoked a cigarette. So all of those particles are what come into when you can smell that somebody's been smoking, and basically those particles can also affect a child's lung who has asthma. So we want to try to minimize that exposure as well. So I usually recommend that parents who are smoking not only stay outdoors, but also use a smoking jacket or some article of clothing that they put on only when they're smoking, take it off when they come back in the house, and then wash their hands, wash their face really well before they go back into the house and pick up your child and start playing on the furniture and getting into the day-to-day activities. Other things to think about. So allergies definitely can contribute to worsening flares. I think most families of children with asthma will say there's a certain season when it tends to be the worst. So sometimes that's summer when they're outside and they're doing a lot of sports. Sometimes it's winter when the cold air hits. And other times it's really the change of seasons when their seasonal allergies tend to be worsened. So making sure that we have the allergies under control is going to be very important for controlling their asthma symptoms. And generally just the more fit that we are, the more that we're seeing your lungs are improving and the quality of your breathing can improve. What I definitely don't like to see is when parents say, I think I have a solution to my child's asthma, so I'm just going to keep them inside only and I'm not going to let them exercise. And as long as I do all of those things, I think I have their asthma under control. That is the opposite of what we really want to see for children. We want them outside running around in fresh air, and we absolutely want them exercising. That's their best way to stay healthy and fit and sort of create the best lifestyle habits for them ongoing. So what we want to do is get those symptoms under the best control possible so that they're not having that chronic cough, they're not having those wheezing exacerbations, and we can really do better to get them outside and get them exercising again. So the next question I often am asked is, what should we do if I think my child has asthma? What's my next step? I would say the next step is that you should plan to come into your child's pediatrician, have them evaluated. It's not necessarily as easy as just having a few episodes of wheezing, so it gets a little bit more complicated than that. There are children who, when they are very young, sort of infancy and young toddler age, might have a couple different episodes where when they get a virus of some sort, they have some wheezing that goes along with that. And those children might actually also be improved with some medicines like Albuterol, but that doesn't automatically get them a diagnosis of asthma. So usually we will refer to that as reactive airway disease when they're having sort of multiple episodes of wheezing at a young age, often in the context of a viral illness. And it's only as they get a little bit older and are continuing to have those episodes with or without a virus and maybe some other things causing it, other triggers that we're able to identify, that we would go on and officially give them a diagnosis of asthma. So often parents are a little frustrated when they see me and their child's wheezing and they're only 9 months or so and I'm not ready to tell them this is definitively asthma. The good news is for some of those children, they might go on and never wheeze again. For other kids, especially with strong family histories or other exposures, they might be more likely to go on and develop asthma down the line. So it's unfortunately a little bit of a time will tell situation, and we can follow over time. And definitely when you think that your child's wheezing on an ongoing basis, make sure that you're coming in to see the doctor and not just sort of treating it at home and thinking that you have a sense of what's going on, so that someone can really be keeping track of how frequently they're happening and get a much better sense of how to control them and if we need to give the diagnosis down the road. So the other thing to know is that even if we do give that diagnosis of asthma, that doesn't mean that you're stuck having all these recurrent exacerbations. There are a lot of medicines that we can use to really minimize the effects of having asthma so that your quality of life can be dramatically better and we aren't as limited to having to stay home and miss soccer practice and miss all of the fun things that are part of being a kid. So the next question I'm often asked is, what do we do to treat asthma? Which is sort of fitting. So the most common medicine that people think about when they're thinking about asthma is a medicine called Albuterol. So if you go back to the example I gave you of what was happening during that asthma exacerbation, you're getting that constricting of the muscles on the outside. So when we do the albuterol, it's actually to release some of those muscles to open it up a little bit so that even if it's inflamed on the inside, you're actually able to move air a little bit better. And that is what we call a rescue medicine. So we really want to save albuterol for the times when you're having symptoms directly. You want to use that medicine either via a nebulizer or an inhaler with spacer. And that's going to be the best way to get the medicine to your lungs in that more emergent situation to help relieve the symptoms and to make you feel better. There are some children who might have very infrequent symptoms and are able to only have albuterol as their only medicine, and that medicine can just be used for those rare times when they're having their symptoms acting up, and then they can go on with their days normally without any other issues. There's going to be other children who are going to need something called a controller medication. So a controller medicine is basically designed to decrease the inflammation on the inside of the airway that we were talking about. So on an ongoing basis, we're kind of not sitting as inflamed. So if you look back at the normal airway and the ongoing inflammation that you see in asthma, we want to decrease all of this inside thickening so that we can have that nice open airway at baseline. And then even if you do happen to come across one of your triggers and get a little bit of the constricting on the outside, the tube is not getting nearly as narrowed, and as a result you're not feeling those symptoms nearly as often, so that we can really minimize how frequently kids are having these asthma exacerbations by getting that controller medicine, which is going to be a medicine that they're going to take every day. Some of those are going to be inhaler medicines that they're going to be taking either once or twice a day, depending on the medicine. And then some of them might also be ways to control their ongoing allergies so that we're decreasing that as one of their triggers. A question I'm often asked when it comes to medicine is also, what is the best method of getting that albuterol in? So is it the nebulizer or is it in the inhaler? And I think the answer is listen to the doctor who's prescribing it, but for a lot of kids, even at a young age, the inhaler might actually be a more effective way of getting the medication to their lungs, which is why that's the more common one that's prescribed for families to have at home after pretty young infancy. We are tending to see that it actually is getting better delivery to your lungs, so we want you switching to that inhaler at a much younger age than what had been used traditionally in the past. So other questions to think about is how do I make sure that my child is safe in all settings? So I don't just want that albuterol to be something that the parents have access to. I want to make sure that any caregiver who is taking care of a child with asthma in any setting, including in school, has access to an albuterol that they can use as that rescue medicine. Because if your child is with somebody else or in school setting, I don't want them to start having their exacerbation and feel like they can't breathe and sort of let that panic set in that they don't have a way to get their medicine. So along with that, you want to make sure that there's a second inhaler for the school setting, and you want to make sure that whoever's taking care of your child knows how to use it appropriately, or that your child, if they're old enough, knows how to use it appropriately, and that they know the indications for using it. So in pediatrician's office, we use something called the Asthma Action Plan, which is going to be a basically color-coded cheat sheet that you're going to use to help yourself and other people know when to advance. So usually on the green days, for those children who only have albuterol at home, they don't have to do anything. For the children who have controller medicines or allergy meds of some sort, we'll identify that those are the medicines. The green days are the good days when you're not having any symptoms. You want to use those medicines no matter what on a day-to-day basis. And then we go into the yellow days when you're starting to have some indications of symptoms, and that's going to be when you start using the albuterol in addition to your controller medicines. And then the red zone is usually what we think of as more of that emergency situation where you really need to get evaluated by a doctor fairly quickly, and you might increase the dose of albuterol that you're using in that setting to make sure that you're getting the care that you need. So what happens if we are not identifying and treating asthma? What we tend to see is that kids' quality of life goes down a fair amount, unfortunately. So they're doing a lot of the things that I talked about before. They're not going outside, they're not playing sports, they're not really participating and engaging in all of the things that they love and want to do. But unfortunately, even more severely, if you don't identify and treat appropriately for an asthma exacerbation, children end up in the hospital, sometimes for a fairly long period of time, and sometimes even in the ICU. And then unfortunately, we still do see some childhood deaths from asthma if it goes particularly severe and untreated. So we want to make sure that any kid with asthma is not putting that at risk, and that we are minimizing how often they're brought into the emergency room or especially into the hospital, and really able to stay and play and do all of the things that they love to do as children so that their quality of life can improve. The other thing that can absolutely prevent getting admitted to the hospital and having these bad exacerbations is getting your flu shot on an annual basis. So all children are recommended to get a flu shot yearly, but especially children with asthma and especially family members of a child with asthma should plan to get it every single year to decrease those exposures to influenza, which is one of the infections that can be much more severe and land a child in the hospital if they have asthma. The last question I'm often asked is, can my child with asthma be cured? Unfortunately, at this point, we do not have a cure for childhood or adult asthma. It really is considered a lifelong diagnosis, but absolutely your quality of life can continue to improve over time. So there are some children who have a lot of exacerbations when they're younger, and really as they grow up and their lungs are bigger, they learn a lot better how to use their controllers, they learn a lot better how to maintain it. They often grow and have much fewer episodes of those symptoms, and even are able sometimes to wean off of those controllers so that they just need the albuterol on hand for that rare emergency, but otherwise are not feeling those symptoms on an ongoing basis. So at this point, I'm going to wrap up. Again, if you have more questions about childhood asthma, please leave them in the comment section below. I'll answer them within 2 business days. And to make an appointment at the University of Maryland Pediatrics at Midtown, please call 410-225-8780. Thank you so much for watching.